Seeking infertility treatment can be a draining process and a financial burden and very frustrating. Your friends may be having babies naturally. Others have insurance that directly covers their IVF and other infertility treatments. Meanwhile, your insurance isn't paying for anything. If this seems unfair and arbitrary, it is. Unfortunately, for many couples who are trying to conceive, these issues are just the tip of the iceberg. Think about what happens when you conceive. You may have to first pay money out of pocket for all of these treatments, but you may not have the money. You may be borrowing money on credit cards, on a home equity line of credit, but it may become very difficult to pay these loans back if you're blessed with a baby. Because, well, at minimum, you're going to be missing out on mom's income during her maternity leave. But then complications may arrive before delivery, and mom may be out of work for a month, 2 months, 3 months or more. And IVF is often associated with multiple pregnancies, which are often born premature, leaving you with lots of unexpected and unpaid hospital bills. This can be a real problem. But fortunately, there's some answers, there's some hope. Hi, my name is Kevin Haney. I'm with ASK Benefit Solutions, and I'm going to walk you through 3 critical aspects that will help you to lower your costs and create security for you and your family. We're going to look at how you can quickly determine if you can get insurance coverage that will directly pay for your IVF, and if not, how to unlock the hidden value in IVF rebate programs and how to leverage that information using supplemental insurance. So let's take a look at how to determine if you can get that direct coverage. The U.S. insurance marketplace for IVF and infertility treatments is a confusing mess. There's going to be a minority of winners and a majority of losers, and it's important to understand which category you're likely to fall into. Take a look at market forces. Infertile couples are profitable customers for insurance carriers. You're young, you're healthy, you're paying more in premiums than you're getting back in benefits. Once you introduce IVF into the equation, the insurance carrier is going to not only have to pay for your IVF treatments, but also the resulting pregnancy, which could become very expensive if complications arise. So most insurance carriers are just not going to want to do that unless compelled by law. And there are 15 states that have laws that provide for some level of IVF or other infertility treatment coverage. So do your homework and understand that the avenues that you want to look at, first look at your own employer's insurance plan, also look at the plan of your spouse, and then maybe in the individual market you might be able to find something. The most important thing to know is that the laws apply in the states where the plans are issued, and group health insurance plans are issued in the state where your employer is headquartered. And if you work for an employer who's headquartered in another state, you may have access to these types of mandates. They're exported across the country to the employees who live in a variety of states. But before you get too excited, understand that there's holes. These laws are full of inconsistencies and holes. For example, there's only 3 that cover both individual and group plans. There are 5 that mandate both IVF and other infertility treatments, while 4 exclude IVF altogether, and 4 others only allow IVF. There are 2 that exempt HMOs and 3 that restrict it to HMOs only. There's 3 states that exclude groups based on employer size, and all of them exclude groups that self-insure as well as any religious organization. If you find yourself in that unlucky majority that has to pay for your IVF costs out of pocket, you may want to consider some of the advantages of IVF rebate programs. They do 3 things for you. First, it allows you to purchase a batch of up to 3 cycles, which is kind of like getting a quantity discount on all of your cycles. Second, they'll rebate up to 75% of the cost if you don't bring home a baby. That allows you to preserve your resources so you can try again or pursue adoption if that's the thing that you want to do. The third, but the hidden thing, is they only offer these programs to qualified couples. They're going to do extensive medical testing, and if afterwards they think the odds are very high that you're going to conceive and bring home a baby, they'll offer you this rebate program. But look at it this way, they're using their insider information to make an informed decision. And what we suggest you do is you use that same information to your advantage. Buy supplemental insurance that's going to pay a cash benefit directly to you when you deliver your baby, and that's going to allow you to offset much of your IVF costs, but also create some very important security for you. Your odds are going to be high. You're going to know the date of conception around a rough time frame, so you can time the start of your programs in an ideal way. Now, short-term disability is going to pay a benefit during mom's maternity leave for her normal labor and delivery, but also will pay additional benefits should she experience complications prior to delivery or after delivery as well. Hospital indemnity insurance is going to pay a cash benefit directly to you for mom's normal labor and delivery hospital stay, but most importantly, it's going to pay an additional benefit should your child or children be born premature or need some special care in a neonatal intensive care unit. So these are two ways that you offset some costs, create that very important security for you and your family. So what I suggest you do is you visit our website, www.growingfamilybenefits.com, learn about and research all of those state insurance laws, read up a little bit more on IVF rebate programs, and then download our free case study, The 9 Things You Need to Know About Supplemental Insurance Before Getting Pregnant. Good luck and be blessed.